Hi, my name is Dr. Jennifer Jew. I am a physician who graduated from Brown University Family Medicine program. I am also a wife, a mother, and a daughter who, like many of you, are juggling the demands of caring for children and aging parents. I've lived in New Haven County for 18 years and have developed many connections and friendships here. I got the COVID-19 vaccine because I care about my health and the health of my family, friends, and neighbors. Our health is important and people depend on us. So it's understandable to be cautious and have questions about the COVID-19 vaccine or wonder if you really need it. Some of you might be young and healthy and think it isn't necessary. You may have heard that the rates of hospitalizations are going down. Many restrictions have been lifted. You have noticed that the mask mandate is easing up. You could think, well, enough people have gotten the vaccine. I'm protected by herd immunity. It may seem like the pandemic is over. And many of you may ask, how were these vaccines created so quickly? Why should I take the risk? These are great questions. In this video, I'm going to answer some common questions about the vaccine. So let's start by talking about how the vaccines were approved so quickly. How could something that normally takes years to approve get approved in less than a year? The answer in part is because we have improved efficiency due to more knowledge, experience, and teamwork. For example, have you ever tried something for the first time? Maybe try out a new recipe, and over time you get faster and more efficient at it? In this case, many parts of the recipe or vaccine process were already in place, so the scientists could hit the ground running. Instead of having to go to the store and get all new ingredients or having to read the recipe for the very first time, scientists could use the mRNA and adenovirus technology that has already been studied and in development for years. Thousands of people in the United States and all over the world have participated in research trials so scientists could be sure of the vaccine safety and effectiveness. We also have better teamwork now. The urgency of the COVID-19 pandemic brought scientists together and in collaboration with public health agencies like the U.S. Department of Health and Human Services, Center for Disease Control and Prevention, the United Nations, and the World Health Organization. Now, let's talk about safety. The COVID-19 vaccines manufactured by Pfizer, Moderna, and Johnson & Johnson have passed many tests and have been tested in thousands of people. All the vaccines have met the FDA criteria for safety and quality. But you may still be hesitant because you are concerned about the risks from getting the vaccine. Well, you're right. There are risks. There are risks in everything in life. And like everything in life, you make a calculated decision about whether or not the benefits outweigh the risks. For example, when you get into a car, you're taking a risk. According to the CDC, from car accidents alone, over 5,000 people are getting injured daily in the United States. This number is far greater than the complications reported by the CDC and the FDA. On top of that, it's still unclear how many of the complications are directly caused by the vaccine. So when you look at the numbers, it's far riskier to get in your car than it is to get the COVID-19 vaccine. So we've discussed how the vaccine was created, quickly and safely, but maybe you still want to hold off on getting the vaccine for yourself or a family member. Perhaps you think that since others have taken the risk and gotten the COVID-19 vaccine, you don't need to, because you are protected from something called herd immunity. Well, according to recent data from the CDC, about 52% in the United States have received one dose of the COVID-19 vaccine. Although the exact number needed for herd immunity is not definitely known, many experts agree that the percentage needed for herd immunity is much closer to 100%. So at this time, we aren't even close to that in the United States. This means that if you have not received the COVID-19 vaccine, you cannot rely on the fact that some people in your community have been vaccinated to protect you and your family. On top of that, if you're not vaccinated, then unfortunately, you and your family are at the same high risk of hospitalizations, life-threatening illnesses, and death as we faced in the beginning of the pandemic. The bottom line is that the COVID-19 vaccines work. It is true that we are in a much better place as a community and country than we were a year ago. At this time last year, there was no indoor dining. Most of the kids couldn't attend camp in person, and we weren't able to visit our friends and family without wearing masks and keeping 6 feet apart. Because of the vaccine, there are fewer restrictions. We can now dine at restaurants indoors. Our kids have been able to attend milestones like in-person graduations and go to prom. We are finally feeling like life has gotten back to normal. But the pandemic is not over. We need to be fully vaccinated. Fully vaccinated means having received one dose of the Johnson & Johnson vaccine or both doses of either the Pfizer or Moderna vaccines. Recommendations were made by the CDC because the evidence shows that people who are fully vaccinated are at a much, much lower risk of getting the COVID-19 virus. The reason why restrictions have been lifted and mask mandates have loosened is because the vaccines are so effective. Even though the vaccines aren't 100% effective at preventing COVID-19 virus transmission, and let's face it, in life, practically nothing is 100% guaranteed. But if you do get infected with COVID-19 after being fully vaccinated, the vaccines greatly reduce the chance of you getting life-threatening illnesses or being hospitalized. There are many countries who don't have access to the vaccine, and they are suffering greatly due to COVID-19. The pandemic is so much better controlled now in the United States thanks to access to the vaccines. But it's not enough to have access, though. We each have to do our part. I have had friends and colleagues die from COVID-19. There are communities which are still suffering from this virus due to low vaccination rates. We need our country to heal physically and emotionally. We need our businesses to stay open. COVID-19 has not gone away. We can lose the progress we have made towards normalcy if we don't get vaccinated. So let's do our part. Get vaccinated, from the young to the old. Do it for the brave first responders. Do it for your friends. Do it for your family. Do it for yourself.